Hey, there we go. Okay. Hi, everybody. I'm Kevin Field. I'd like to thank Mara Whitman and the Bloomfield Public Library for inviting me to talk with you. So I ask, how can you thrive in a world that wasn't designed for you? Let's face it, the world revolves around young, healthy people. For the millions of people with medical conditions, health issues, or special needs that are either physically or developmentally challenged, that's not just a question, it's an everyday reality. And how do I know this? Because I've lived it with my son. My eldest son, Harris, has had to work hard for things that many people take for granted, like making friends, finding inspiration, having hope, accessing information, discovering social events where he felt included, searching for volunteer opportunities, and eventually job hunting. Every step along the way, he had the same challenges: constant barriers, few opportunities, and limited access. My wife and I did everything we could to help him. We struggled to find good information, essential resources, support, parents of similar children that we could talk to, the right doctors, various therapeutic programs, and special needs legal and financial advice. One thing became evident to me: we weren't alone. There are so many families and so many individuals facing the same challenges. And that realization changed everything for me. I knew I had to do something. And beyond our family, I've always been passionate about helping those facing medical challenges. These experiences inspired me 3 years ago to start building Wefayo to help as many people as possible. Wefayo is a free national platform designed to connect people who need support with those who can offer it. But it's not just about resources, it's about belonging. It's about creating a place where people can find comfort, guidance, and real opportunities. One of the biggest frustrations I've seen is the struggle to find reliable information. Where do you go when you need help? Who do you turn to? And too often the answers aren't clear. That's another reason I created WeFio, to bridge the gap and make sure no one has to navigate the journey alone. With over 170 unique communities and growing, WeFio offers essential resources, exclusive content, friendships, job and volunteer opportunities, private discussions, social activities, therapeutic workshops, and training events. It also has stories of inspiration: athletes, entrepreneurs, professionals, and everyday people who have overcome major physical or developmental obstacles. For example, like Sophia Jarrell, which is Victoria's Secret's first model with Down syndrome, and Larry Nance Jr., an NBA star with Crohn's disease. People can go on to Refio, read about these and so many more role models, and be inspired to break through the glass ceiling. There are tons of people that have various obstacles and have done amazing things. And so I wanted to share all that so that people can learn about it, and be inspired to break through their own glass ceiling. Refile is also the first platform of its kind, continuously expanding to support every medical condition that there is, every health issue, and every special need. New items are added on request. So right now we have 120 medical conditions, health issues. I'll give you an example of a few. I'm not going to go through all 120. Certainly put you to sleep. We have things like acne, Addison's disease, Alzheimer's, anemia, anxiety disorder, cerebral palsy, cervical cancer, bipolar disorder, hemophilia, um, human, well, HIV, human immunodeficiency virus, hypertension, kidney stones, mast cell activation, migraine headaches. The list goes on and on and on. And so if somebody goes on to eFile and there's a medical condition that they have or one that friend has and they'd like added, I'm happy to add it, do the medical research, and create a community around it so that people can share information, discuss it, and I can share resources on it. Wefayo also promotes businesses that are owned or operated by people with medical conditions and special needs. So for example, we've got Drew Davis, who has cerebral palsy, who created a hot sauce company called Crippling Hot Sauce. And I'm going to show you all this stuff in a few minutes. We've got Ali Bach, who has autism. He and his mother created a cookie company, and together they bake cookies. They send them out. People can buy cookies from them online. In total, I'm promoting about 35 businesses of people with special needs, encouraging other people to support these deserving handicapped entrepreneurs. Here's the best part. WeFile is completely free. There are no fees, no collecting of sensitive data, and no data selling. It's just a platform built on trust, support, and making a real impact. I'm sure you know by now that when you go onto a platform and it says it's free, what they're doing is they're collecting and selling everything there is about you. I don't do any of that. And in the privacy policy, which is documented on the platform, it says you can join under an alias name um, because none of the data is sold. So the idea is that people could go onto the platform and be honest and open and ask others questions, and nothing they enter is ever sold. And the other thing is there's everything is based on screen name. So if you sign up and your name is Jack Jones, nobody will ever know you're Jack Jones. You could pick a screen name or the system can pick one for you. And that's how people will know you. You're full anonymity. So privacy is something that is built into this. I'm personally funding this platform. I built the company 3 years ago. I started it 3 years ago, and we have several employees, and I'm paying them all out of my savings. And that's to make sure that it's free and accessible for anyone who needs it. I don't want someone saying, I can't get the resources I need because I don't have the money to sign up. If you need resources, you should be able to get them. So if you, a friend or family member are looking for connections, resources, or a way to give back, WeFio is here. I'd love for you to check it out, and I'm going to show it to you. The website is wefayo.com. Again, you'll see the name. Join, spread the word, help build a stronger, more connected community. So I'm going to go in and show it, but before I do, anybody have any questions to start?
I do. How did you come up with the name?
So the name is two words, we and FIO. We is society, we. FIO comes from the African word, the Luganda word okofayo, meaning care. So across the two languages, it means we care. Naming it was actually the hardest part of it. We knew what we wanted to build, but we were wrestling with names. We were thinking of other names like We Care. We tried about 200 names. Everybody buys and reserves websites, even if they don't build them, under every name possible. So if you want to use it, like when I wanted to use We Care, brought it up and it said, this is for rent or for sale. So I contacted the guy and he said, it's $20,000 if you want to have a website called We Care. And I said, well, what I'm doing is a philanthropic platform, self-funding, whatever. He said, that's really nice. It's $20,000. Like, okay, how can we come up with another way to do this? And that's how we came up with the name.
I like the name very much. I was just curious.
Thank you.
And when you go into the website, can you talk about like how do you get a disease added? And also, does someone monitor like the comments that are put on so that if there's inappropriate things, someone is aware of that?
Great comments, and I'll go through them one by one. First, I want to make sure, can everybody see the screen? You know what? I'm going to move the screen to be in the middle so now you can't see it anymore, but I can unshare and reshare. So let me do that. I think it's easiest if I just share straight ahead. Okay, can everybody see it?
Yes.
Yes, we can see
Okay,
it.
thank you. So wefayo.com. So for anyone who's new, it also works on, by the way, not just a computer. It also works on an iPhone, an Android phone, iTablets, Android tablets, but it always looks best if you're using it on a laptop or a computer or a Mac because it has a much bigger screen. So for anyone who's new, the first thing you might want to do is just come here and click on Get Started in purple, because when you click on it, it gives you an interactive tour. It welcomes you, takes you, it points, it lights up different things, it tells you what they are. I mean, I'm going to talk through them and give you something a little more comprehensive, but it's an interactive tour for people who are starting out. So across the top, we have communities, jobs, activities, chat. You won't see PPs. It's only because I'm an administrator. It stands for premium positioning, where we can add things down the side, and invite. So let me actually get out and start from the beginning. So if anyone is interested, what they would do is they would click sign up, and they can join as a person or as a company. The difference is, as a person, you can post whatever you want. As a company, you can also create activities, jobs, volunteer opportunities, social programs, all kinds of other information. So let me come back. Let me sign in. And this is where somebody's profile would be. You can ask for new communities. Mara was asking, how do you create new things? Now I'm going to give you the tour and show you that. Um, and you could also ask for support. Like if you run into any trouble, click on support and we will get your email and we'll help you through it. So let's start with communities. The idea here is everything is built around a community. So we have the autism community. We have anything goes community, other special communities, complementary practices, workplace and talent, inspiration, businesses, federal and state resources. So within a community, let's look at autism as an example, you have many different things within here. So for example, within autism, you have autism spectrum disorder, and you can see there's kind of a purple color here, lavender, or there's lavender here. You could click on anything and everything expands into something else. So if you click on autism spectrum disorder, you have about and you have a post. Everything, every one of these 170 communities has something called about. And it describes what it is. So in this case, autism spectrum disorder, name of the medical condition, what is it? How is it diagnosed? How is it treated? What is the trend? How many people in the last 5 years have had it? How many people have it today? How many people are projected to have it over the next 5 years? The history of it and where I get the information from. And I get the information from all top name places. A lot of them are government resources or leaders in each particular disease or medical condition. Do want to mention, rather than just, if you're going to start a treatment regimen, talk to a doctor. Always talk to a doctor. You can't beat what a medical professional, no platform can beat what a medical professional can help you with, being candid. The other thing is all of these are written in eighth grade language because you have people of a variety of backgrounds. And I wanted to come up with something that would be reasonable for everybody to understand. I think newspapers are written in eighth grade language. So that's how I came up with eighth grade language. Again, profound autism, and you could click on it, get more information. Dating and friendships. I already have somebody who's going to add something here. I'm working with them on the profile. Most of you know my eldest son, which was my inspiration, as I mentioned, for creating all of this. So working on a platform for Harris. But the idea is that people can come here, whether they want to meet someone to date, or they're looking for new friends. This is the place to introduce yourself. I also have an autism certified travel agent who is providing free content and knowledge and information and education For example, there are certain things that airports do to help people with autism. There are hotels that are certified. And so Bryn and her two friends will be posting content here on a regular basis. I don't think people know that there's such a thing as autism certified travel agents. And then other topics that people with autism want to write about, talk about. So that's what that is. Anything goes, whatever people want to talk about, they could just create here. Um, you can also request a community, which can add more topics or more of these high level community things. Just any way you see request a community or in here, community requests, and I typically turn those around within a day. Other special communities. So this is the other 120 medical conditions. So I broke autism out because a lot of people were asking me to, because there's so much autism in this country that people wanted it to be its own thing. But here, got the other 120 things, all, anemia. Does cooking in iron pots really give you more iron, or is that a myth? I have some research on that. Bipolar cataracts. This list goes on forever and ever and ever, and I'm happy to add more things. So included in this list are things like, in this case, Biogen released a new medication for Alzheimer's disease. You could click on it so you can read about it, see when it was released. Biogen here talks about how they are researching and addressing Alzheimer's, what things they're doing specifically, and a video on their website to provide more information, basic overview of Alzheimer's, more information on it. And you could also click on this and go to their website and learn more about this new drug. Just so you know, I mentioned everything here is free. So Biogen is not paying me for this information. Nobody pays to put anything on the platform. So you might think this is free advertising. I view it as people with Alzheimer's want to know that there's a new drug that was recently approved by the FDA and released. So, like I said, nobody pays anything for this. It's more about sharing information. Um, At one point, somebody who I know and love thought that their dog had Addison's disease, and so they posted about it. Um, and you could, example, just search, like if somebody is looking for pulmonary embolism, P-U-L, I think that's how you spell it. Pul, I have no idea how to spell E-M-B. Here it is. So for example, what happens here is you had the about, as I was describing before. Somebody wrote 2 pages on what life is like. This young man in California, what life is like having a pulmonary embolism. And then anyone can respond here, can post here. Somebody else did ask follow-up questions. Somebody else commented on it. And so you could really add any topics or respond to other topics. And if there's something that you have or something your family has and you want to hear from other people about it, just post it. Let other people comment and share information. So anybody can post. Then we have complementary practices, different things, holistic medicine, therapeutic horseback riding, meditation, mindfulness, organ donation, remote doctor visits. Again, any of this stuff you could just post or add to. So for example, on therapeutic horseback riding, I didn't realize that therapeutic horseback riding was such a big thing until I researched it and saw that it could help your posture, your confidence, your well-being, soft skills development. So put that here. I put where I got the information from. And turns out that there's a farm near my house that provides therapeutic horseback riding for handicapped people. And so they're able to talk about it and how they're able to help people. Again, you might think of this as free advertising. I view it as people in the area will want to know about this so that they can benefit from that therapy. By the way, let's make this interactive. If anybody has questions, just jump in. You don't have to wait till the end. Keep it open for
Valerie,
anyone who
what
wants to
is the
add.
name of the disease that you primarily work with?
We do hypothyroidism, we do idiopathic pulmonary fibrosis, bronchiectasis, and those are some like rare disease. Well, bronchiectasis is more rare. But yeah, so I think it'd be cool if you maybe did a section for clinical trials because a lot of the time people have a hard time finding participants for clinical trials and maybe they could like give information um for the
Be
website.
happy to add it. Yeah, I'd love to add it. We do have hyperthyroidism.
Mhm.
You know, other names it's known by, what is it, what it's caused by, the trend, the history of it, and where I got the information. Mayo Clinic, American Thyroid Association. Yeah, absolutely. So if there's something you want to add, you can add it or I can help you add it.
Yeah, and I know I have a lot of contacts with different pharmaceutical companies, so if you ever wanted me to share with them,
Please, absolutely. I mean, we've
um,
got that thing by Biogen.
yeah.
Any pharmaceutical company can talk about the research they're doing. They could have something within a medical condition. So like here, the idea is anyone who looks up Alzheimer's, they can see this. And what they can do is they can also text with the person who
Oh,
created this.
cool.
We've got a
Yeah, and
chat
I
built
do
in.
a lot of registries too. So like registries and clinical trials that people might that don't even know that it exists until they go to their doctor, but if they go here then they can see that it exists.
And there's a lot of things I'm doing that are bringing traffic here. Every week, there's a different um, campaign going on. And so if there's anything you want added, absolutely. And I will continue to drive traffic here so people know about it. This is an interesting one, workplace and talent. So the idea here is to educate people that those with handicaps can exceed in the workplace in areas that a lot of people can't. So this is based on research by Harvard Business Review, HBR. So for example, people with autism excel at recognizing patterns, seeing correlations in large amounts of data. People are with dyslexia are great at this. People with disabilities are great at that. People in wheelchairs are great at this. It's just a lot of stuff that I don't think people realize. So they can see this summary or they can actually, see the Harvard Business Review article. Because am also trying to help people with various medical conditions get jobs. Um, other things. So inspirations, near and dear to my heart. The idea here is people with developmental or physical handicaps doing things that are amazing. So within here, we have performances that inspire, talents that inspire, athletes that inspire, Special Olympics, models that inspire. And so the thought is that if somebody has something, they can come here and see somebody who has something similar. So let me show you this one. This is a young lady who obviously is a ballerina with no arms or hands. I have her story here, and people can watch her performance. And I'll just skip. So if a young person missing a limb doesn't think they could ever be a dancer, come here and watch this and see. And saxophone player, autism, just inspirations from people that, are overcoming tremendous barriers. This guy, so some of you know I'm a car guy. I met this guy. He lives in Belgium He's known as the autism car spotter. He has autism. He has a camera and a passion for cars. Goes around the world taking pictures, and people could follow him. I have his Instagram stuff. Um, I have his website. He is now approved by Ferrari to be a Ferrari photographer and photograph their cars. Good friend of mine in the Carolinas has a son with special needs, and they're trying to help him figure out what he wants to do for his future. And just by learning and seeing all this, they're going to help him get digital photography lessons and become a photographer with special needs. And I know somebody who's going to teach him for free. So these are businesses owned or operated by people with special needs. So as an example, food and drink listings. Um, let's see, here's one. Matthew has Down syndrome, and Matthew has a barbecue sauce business. People can buy online for Matthew. Then we've got, Drew Davis with his crippling hot sauce business. So the idea is that there are many different categories within businesses. A long list of food and drinks, wines and spirits, gift baskets, cards and crafts. And I've bought from some of these folks art, people who paint with their mouth or their legs since they're missing arms, beauty and fragrance businesses. I mean, the whole idea is that these are very deserving entrepreneurs. And I put them here with the hope that people will come here, read about them, read their story, and buy something from them. Then we've got federal and state resources. So people want to know, what does the state provide or what does the government provide? And if you Google, trust me, you'll never find what you need. You get bounced around and bounced around, even if you use AI tools. So I started a list. I have 5 or 6 states, and it's very time consuming, like California. I put together the list of who they help, the type of assistance, and the link. California and New York each took me 5.5 hours. And this stuff really takes a lot of time, but it's valuable. So those are communities. I can add more if somebody wants something. Then we've got jobs. So here, these are job and volunteer listings, and I've got a couple of people who are focused on this, reaching out to employers. And the thought is that any employer that will hire somebody with medical condition, health issue, or special need can post the job for free. And what this does is it gives them access to a new talent pool, because many folks with special needs don't go out to Indeed or any of the popular job sites. So it's a win-win. People can find jobs here, and it's all posting for free, and it's jobs and volunteers. And then of course, you could search hybrid, remote, full-time. And if you open them, there's more details, special accommodations, so forth. Then we've got activities. Again, if anybody has any questions, just jump right in and just ask. So under activities, also building this out, we've got multiple states listed here and continuing to add. So someone could search on program launch, a social event, a training event, virtual event. So for example, like program launch, these are all various programs. People love this one. Somebody with special needs can go to this bakery and bake dog treats. Tells when it's offered, who's hosting it, and people can click on that link and go to the provider for more information and to register. And there's jewelry making, farm, program, art class, there's group exercise, sports, ceramics, and so forth. We also have some social stuff, bingo night, group exercise, karaoke night. We've got training events. We've got virtual stuff, like this is a nationwide online book club for people with special needs. So if anybody knows of any programs or any places that provide programs, please tell them they could come here, they could post for free, and more people will learn about the services they offer. And if you know any employers, again, tell them they could come here and post their jobs for free. Anybody who posts or comments, you can chat with them. Again, your name is never revealed. Everything is just purely by screen name. I was texting with my wife through this. If there's somebody that you want to invite to join, you can put in their name, their email address, and a message. Hey, this is what I was talking about. And when you hit submit, you'll get an invitation from the system with your name and a link to click to automatically join. Or if you want to put something on social media, you just hit this. It will copy the link, and then you could go to social media and post the link. A couple of other things we have. Here we have, take a step back. So having a special needs child, many years ago, we set up a special needs trust. Over the years, so many people have asked us if we have a special needs trust and where we got to create it. Apparently, there aren't a lot of people that know how to create it. Well, I met a person who owns a company that does special needs trust, really nice guy. He's in North Carolina. And I posted this here so people could come here, click on it, and get the special needs trust or any special needs financial advice. Again, they don't pay me anything to put it here. It's just I want to share it with people. On the left, we have invitation leaders. So I wrestled with how can I create or provide self-esteem for people with special needs, some of them who are not able to work. Can I do make it easy for them? I came up with the idea that if they invite other people, they can make it onto the leaderboard. Or if they click like, or they post, it could make it onto the leaderboard. Because as you know, everybody needs self-esteem. So that's what these two things are here. And you could also chat with them. Samantha probably knows who EAF 124 is. Um, and then here we also have feeds coming in from, oops, feeds from the FDA, feeds from the Mayo Clinic, Cleveland Clinic, CDC. They change every few minutes. Sometimes they come in on Spanish. So that's Wefayo. The only other thing I want to show you is data collection, not asking for confidential things. When you sign up, we don't ask for street address, marital status, gender, date of birth, or medical conditions, and people can provide any name, sign up, and I don't give, sell, or transfer any information. It's all private. So that's the bulk of the stuff. I want to answer Mara's second question, which was about monitoring content. Before I do, does anybody want to ask any other questions? I know I've been talking a lot, but I want to be sure everyone has a chance to ask questions. Okay, so on the platform, we have terms and conditions. So for people to use the platform, they agree not to do certain bad things. Can't post anything unlawful. You can't be abusive. You can't harass anyone. You can't impersonate anyone. There are rules and regulations. We don't directly monitor anything because we want people to have freedom to put whatever they want out there and not feel that Big Brother is watching. So what we ask is that if somebody is doing something that's inappropriate, let me know. Just click on support, send an email saying, John 1234 is bullying someone else, I will get involved. I'll take a look. I could give John a warning. I could remove his content, and I could kick him off the platform forever. That's how we manage negative comments. So
Thank
that
you.
is
The
everything in a
other thing
nutshell.
is, you know what a lot of people I find in the library, a lot of people are looking for like cancer trials, trials for drug trials for cancer. Can you show what you have under cancer? I'm just curious.
Sure.
Because that's
Two ways to
unfortunately
get
a
there.
big
Thank you.
one. Yes.
Someone could type on top here, and it searches everything that we've got, or you could just go to other conditions. You have cervical cancer, ovarian cancer, thyroid, bladder, breast, prostate, colorectal, brain and central nervous system, larynx cancer. It's terrible. There's so many types of cancers. Kidney cancer, testicular, pancreatic, lip and oral cavity, gallbladder, skin cancer, liver cancer, nasopharynx, stomach. It's really crazy, but we've got a bunch of them. So the idea is somebody could come under lung cancer and then read about a clinical trial. If there's one out there, I'm happy to add it. Or they could then come up here. We don't have any right now, but they could type trials. Oh, Biogen, some stuff on trials, color blindness, some trial stuff. But yeah, I would love to add those. Anything else I can answer?
And the focus is nationwide, right? Not just
Yes.
one particular state.
Nationwide.
I'm impressed. This is a lot of work. It's amazing.
Thank you. You're
Yeah.
seeing version 1. So here where it says communities, jobs, activities, chat, whatever, we're working on another one, which is to bring new technology to the world of people that have special needs. We're not creating the technology, but I've reached out to some companies about partnering with them and bringing it right here. Because there's stuff out there that I know people don't know about. I mean, I know there's stuff Eileen doesn't know about. And if I could just bring it here and create something that says tools people can click on and get a list of tools, then they can learn about it, have access to it, and not have to search all over the internet to see if something exists. Any other questions?
Yeah, I think this has been very helpful. Would you be willing to put your email address in the chat in case anyone has further questions, Kevin?
Absolutely. Let's
Okay.
see. Chat. Oh, I see. Oh, that's a question. Oh, Mark is here. Hi, Mark. It's kfield at wefayo.com.
Okay,
And I'm always happy to answer questions.
excellent.
So, and I encourage everybody to sign up. Again, it's free. Create posts, comment on other people's posts. Tell employers they can post here for free. Tell service providers they can post their programs and events here for free. Trials, drug information. Spread the word.
Even libraries, we can post our events on here.
Yes. Yeah, absolutely.
You know, if they're health related ones. So, yeah. Well, thank you very much. I'm gonna stop the recording, but I really appreciated it.
Thank you so much. Giving me the opportunity to share this with other folks. Really appreciate it. Thank you, Mara, and of course to the Bloomfield Public Library.